The program I'm at is called Mental Kokua, and they have multiple different programs within the agency, and the program that I'm currently at is called Safe Haven. So Mental Health Kokua's goals is to be the most respected and trusted mental health organization in the state of Hawaii. Through their trusted relationships, specially designed and culturally sensitive services, Mental Health Kokua is committed to helping people with the opportunities to begin again. So the social problems that is being addressed by this agency is to provide mental health and related challenges to all and assist those who are homeless or at risk of being homeless. The law that I'm currently following is called Assistant Community Treatment, HRS Chapter 334, Part 8, which will allow for court orders to have those with severe mental health get medically treated at an outpatient community setting without going to the hospital. I think this is super important because a lot of our consumers don't want to be medically treated or they're afraid to go to the hospital. So this is one way to build a relationship and trust to get them to be treated in a smaller, safer settings and something more scary. The governance and leadership that Mental Health Kokua has is the board of directors with William A. Wong, who's the chair, Cindy McMillan, who's immediate past chair, Pat Durrett, vice chair, Melinda Yamaha, vice chair, Anna Kidder, chair-elect, Alan Tamahana, treasurer, and Usen Edward, who's a secretary. There's other agencies that we closely work with called Hawaii State Department of Health, Aloha United Way, which partners with a lot of nonprofits and is like the main in-between through all the other organizations, and CARF, which basically keeps us in line and makes sure that we're compliant with everything we do. And in the leadership role, we have Dr. Greg Payton, who is the CEO of Mental Health Kokua, Casey De Souza, who is my clinical lead, and she's the clinical director, which she oversees all the consumers across the islands and ensures that all assessments are done. George Nabia, who reports to Casey, he checks all the RA's work, which is to do the assessments, notes, and to make sure that it is accurately correct before signing off of it and having Casey sign off on the final seal. Les Guzman, who oversees the housing programs and the RAs, Les and Casey works side by side to ensure that everything is in compliance and the consumers are getting treated right and fair. Here is Mental Health Kokua agency structures. There's multiple programs starting with Safe Haven, which I will go over in a little bit and later. But Safe Haven has case management, outpatient services, and a psychiatric doctor. There's also residential services. Within residential services, we have therapeutic living programs, transitional residential services that are throughout the other islands, peer coach, which basically comes into different programs and housing to support the peers, homeless outreach, which is not really necessarily something we do anymore, but it's still within Punawai Rest Stop, which is a partnership with the city, and people are free to come and go and take showers and do laundry and receive help through Mental Health Kokua. Mental Health Kokua mission is to assist people with mental health and related challenges to achieve optimal recovery and functioning in the community. So Mental Health Kokua program goes: Safe Haven is permanent housing, supported housing for single homelessness adults with mental illness. Many homeless people are vulnerable, disoriented, and be victims of crime. So with Safe Haven, we allow them to come into our program and stay for permanent residency or transitional into the community, while providing treatment such as outpatient services and psychiatric assistance. The intensive outpatient services we no longer have, but it's basically outpatient services in Safe Haven, which provides those with mental health and drug and alcohol dependency services and treatment. The peer support is to provide adults with mental illness the opportunity to exercise control over their own lives and recovery and to build resilience. Peer support includes peer mentoring or coaching, resource connecting, facilitating, leading, and recovery educational support groups advocating for person and family and or the community supports. So once that is complete and the person who's getting the peer support feels like they want to help, they become peer supporters as well. So the Therapeutic Living Program is licensed by the State of Office of Healthcare Assurance. TLP is designed as an immediate short-term alternative to institutionalization for single adults with mental illness. It's usually a step down and or diversion from Hawaii State Hospital. TLP services include community placement, access to clinical care, and linkage to needed community resources. TLP programs are located on Oahu, and I think this is important because at my job at Kahimohala, we have some patients from Hawaii State Hospital that get transferred to us, and they're still court mandated to be there and receive help. And once we and the doctors feel that they're medically okay and understand their mental health and charges, and if the court feels that they're safe to return to community, we usually refer them to places like Mental Health Kokua to help assist them from discharge. They also have transitional residence resources, which serve single adults with mental illness, and MHK offers supervised group residential facilities and individualized services in transitional housing settings. MHK programs in this community serves on Oahu, Hilo, Kona, Maui, and Kauai. The collaboration with the community that Mental Health Kokua has is something called CIS, which is the program I'm currently in, and it's called Community Integration Services. And the consumers that we have are residents here at Safe Haven, and I take them out into the community, and we go to the parks, walking, grocery shopping, anything like that, and I just help integrate them back into the community and teaching them basically how to interact with people, what not to do, why we shouldn't be yelling at people even though we're upset, and stuff like that. Other nonprofits that help the consumers who get into Safe Haven is basically programs that Aloha United Way partners with, such as Institute of Human Services and Kalihi Palama, which are all homeless shelters or homeless outreach programs that put some clients here into Safe Haven or other mental health Kokua programs. Another program is UH Manoa Home Project, and it's basically from the University of Hawaii med students that work with doctors to provide a letter that states that the consumer qualifies to come into MHK because they have a severe mental health illness. They also provide medical services and optometry and dermatology. There's also community workers that donate food for the consumers here at Safe Haven and serve to feed them as well. So as an intern, the methods used for me is case management role. I meet with the consumers weekly for a half an hour to an hour each week, but I need to meet a total of an hour each week, and then the total for the month, 4 hours to be processed and billed through the insurance of Quest. Quest looks at my notes and assessments, and I need to do assessments every 3 months to qualify the consumer to continue services. And within those goals, we have keeping the consumer at Safe Haven, cutting back on drug or alcohol or smoking use, as well as financial needs. So the method of accountability that Safe Haven or Mental Health Kokua has is that they pull reports through their system, which is through Aloha United Way program called Caseworthy or Next Step. And in those reports, it has notes and documentation and information of certain things that they need that CARF uses to conduct their audits. Also, Quest uses it for billing. Within our notes at Next Step, we write in it, and then the billing pulls through it to pay for our consumers. And as well for data usage such as HUD, grants, and advocating. So advocating for services that we need, basically showing of how much growth and changes are needed to help ensure that our homeless population and those with mental health are stabilized and can continue to be safe in Hawaii with the resources that are provided.